So you have to know main thing. If you, I'm telling you every class that don't panic in cranial bones. We won't be asking you who is this what is going to passing through this and that. When you do main thing, if you cannot identify a mandible, if you cannot identify a temporal bone, you cannot identify an occipital bone, if you cannot identify what is this big hole, the foramen magnum, all these main features, main key features. Please, first, now at this period, what you do one thing. You study the main key features of the mandible or the bones that is being taught to you. Similarly, there will be some dissections of the head neck region. And now what I want to say, if you know the your bone, the skeletal elements of the skull, it will be easier for you. It will be easier for you to correlate. Okay. Now, what I want to say is that the Greek word mandre, Latin the mandibula, means lower jaw. This is the lower jaw. Okay, like that. Okay, lower jaw. And you yourself always see temporal muscle, masseter muscles, and the location of the parotid, neck muscle, sternocleidomastoid. The muscle related to the first skin and the muscles in the platysma. It is actually related to the skin directly. That's why in any burn, any person gets burned, then there are chances she gets some contracture in deep bones, deep burn, and also there will be some disfiguration of the face. Mind this word, disfiguration of the face, due to its anatomical location of the muscle, and mostly this platysma gets burnt out. Acid thrown into the face, some failure in love, or some girl is ignoring the person, acid hit kora dilo. Then you see, at least in Facebook and all this, you will see the disfiguration. Because of the muscles, there are more than 41 muscles in the face. And these muscles, expression, mime. You know mime? Dakho. Hey, phone kholo. Mime, what is M-I-M-E? Mime. Ki bolche? Mime. Mukha Vinay. By facial expression. There is no voiceover, no talking. It's a part of theatre. It's part of our Indian dances. Kathakali and all these eye movements and everything. So there is 41 muscles of expression in the face. I'm giving you an information, but we won't be asking you what makes it like this, why do you do like this. We won't ask you this viva, but you have to know how many muscles are there in the faces. That's why so many soft tissues and facial makeup and everything is there. Men, soft tissues. Women for soft tissues. Baby, soft tissues. So it is so to be gentle. Any organ, any part of the body. Now, see, I am telling you the Greek word mandre, Latin word mandibula, just for your information, means lower jaw, body and two rami, horseshoe shaped. This is a horseshoe shaped. Have you seen a horseshoe? There is a belief and customs that if you have a horseshoe in your front door, it will bring luck and all this. And if you have an opportunity to go to Darjeeling or go to Murshidabad, you ask that person who's taking you for a horse ride or Pahalgam, you tell him to to show the horse's foot, and you'll see there'll be one metal plate. It's like a U-shaped. It's a U-shaped metal plate horseshoe. There's a hole there. Now, how many of you people have gone to Kashmir? Amongst you, one. You've gone to the Pahalgam? Okay. You don't panic. Don't panic. Don't panic. After all incidents, people still go. Okay. Now, what I would say, that horseshoe, you ask and just they will lift up the two. That's the plate, because they have to walk in the boulders and this thing. Actually, it is very interesting. These horses are in Pahalgam are so much trained, and they just tick, 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 tick. You won't fall. I'm just talking about my wife and myself went to Pahalgam, and we took a horse ride, a pony ride, you can say. Horse is a big pony. Oh, so, but they are in such rhythm and steps, and they never go off shoot, or they don't lose their track. That brain is trained in such a way. Now that's a bakwas I told you. And now what I tell you, the external surface, and this is the, see, when you see the bone, this is the symphysis pubis, symphysis menti, okay, and the protuberance, it's a triangular, this protuberance. This is the unique feature of human mandible. It's a unique feature of human mandible. See, a dead body of a man, a person, only the skull is in one place. The body is in Muluk. This is in Govindapur, the mandible is, the skull is there. But skull is missing, only the mandible is, jaw is there. And animal jaw is there also. It can be dog, it can be monkey, it can be gorilla, it can be anything. But only this mandible is the human, or identify is the protuberance, this triangular area. This triangular area. So if you are given a bone, 2-3 mandibles of different sizes, now only human being or respective animal have 4 mandibles in the table. Okay, now you will be asked which is human mandible. You won't be asked, but I'm telling you just to delineate, and this thing, when you catch hold of this mandible in the table, in the viva, you have to just say it's a horseshoe shape it, and it forms the lower jaw. It is the bone of mastication and chewing. Okay, and the muscles that is in the face, and attached to these, they have functions. Now, identification, these are the 2 ramus, these are the 2 tubercles. For geniohyoid, genioglossus muscle, now that the tongue muscles, and the sockets are there. Sockets are there for the teeth. How many teeth humans have? Hey, 30? 32? No, 36. Sure. Talaguni? 2. Sure. Okay. Then Then I have to phone my, give a video call to my daughter. She's a dentist. अरे भाई जोक तो समझो भाई, समझो, तुम नहीं समझते. You ask Google Baba, then you ask any dentist friend. Okay, now it has, see, the whole mandibular foramen. This is the mandibular foramen. Now mandibular nerves and vessels go through this. This is the dentist nerve, I would say, because all lower jaw can be any in dentistry practice that can be, the mandibular nerve is blocked. Minor surgeries can be performed. This whole thing becomes numb. And when you go into your dental sciences, 15 days house staffship, internship, you will be asked to. That's why I tell my daughter that if it's a impacted tooth or something, then your fees will be 100 rupees. But when you do a loose tooth, that is a tooth that is about to fall or break, that will be 500 rupees. You have to, Buddha ka daat, child ka daat, it's moving. And these are the sockets you have to identify. Don't hold it like this. Don't hold it like this in anatomy. You have to hold it like this. You have to hold it, the sockets are tooth sockets are there. And see, the upper jaw has the maxilla, and they have sockets. Now see, this is the thing. See? Okay. Now, this is one thing. Second thing is the external surface. This is the condylar. This is the conoid process. The temporal muscle is attached here. This is the temporomandibular joint is formed by the condylar surface, and this the synovial joint with the cartilage, and you see there are some impressions. The submandibular gland, this fossa here, okay, and your the muscle. This is the over here the platysma muscle. This is the buccinator muscle inside over here in this portion. This is you just squeeze. Dakho, hath. That's masseter. Now you feel the pulsation here. Arterial pulsation. Okay. Now, what I want to say is that these are the main features to identify a mandible, and main muscles I told you. There are some muscles, small muscles, the mental foramen, the mandibular nerves come out from here. Okay. So, the major surgeries can be performed with local anesthesia, even extraction of teeth or tooth is done by local anesthesia, by mandibular nerve blockage. Now, I told you the foramen is here. Pass. দেখে নাও, দিয়ে দেখে নাও, আর একটা, এটা তো বোধহয় ইয়ে অরিজিনাল নয়, ঢালাই, anyway ঢালাই দেখো. Hey, this is a I think plastic bone, yeah, and it is an edentulous bone. This is a, see, my 1 or 2, 3 tooth has been extracted, and the aged the mandible, you won't get the sockets as such. By age, 80 years, 90 years old, the sockets are the edentulous, they say. Then the surface is the same. You cannot do for this type of jaw, you cannot do these prosthesis. Prosthesis tooth, you know, a screw is there. This portion is ceramic teeth, and this portion is the stainless steel screw. Now that the um, periodontists, they fix up the screw. So if you want, a man wants to eat chicken and mutton at the age of 100 or 90, then he has to put immediately after the tooth has been taken out of at a certain age, or there it put a prosthesis. So that steel screw with this thing, and you can eat mutton, chicken roll in this summer. Sit in Govindapur, no AC. Okay, now this is dekhe now. Please see the parts. Now I'll just see. This will be again. I think there will be a lecture on this, but I'm telling you, the head, the condyle, and the articular surface, TMJ, temporomandibular joint, the articular disc is there, lateral pterygoid muscles. Now the main muscles are there: buccinator, masseter, pterygoid muscles. Yeah, have you seen? See, why Satyajit Ray was a famous director and very particular. Now, if the artist has to walk 19 steps, so he used to draw 19 steps with chalk. But at time I'm going beyond the camera because I am not Shah Rukh Khan. Okay. Now one thing I tell you, holo, এই ওটা দেখে নাও, এই দেখে নাও, আবার যখন এখানে ক্লাসে আসবে আরেকবার দেখে নেবে নিজেদের মধ্যে। আমি টেম্পোরোম্যান্ডিবুলার জয়েন্টটা যেহেতু ইম্পর্টেন্ট, আমি বলে দিচ্ছি কখন ক্লাস হবে না হচ্ছে, যেহেতু এটা আছে হাতে। This is not of this class. If I'm fixed to mandible, then I have to just name other two muscles and this thing. That here small muscle, here small genioglossus, here this thing. The tubercle, main identification point, have mandible. बोलते लागले, what are this? What is this hole? In a practical aspect, examination oriented, 60%. Honors, it's up to you. It's your gold medal is up to you. And a good MBBS is a good postgraduate. Remember this slogan. Okay. দেখে নাও। এই ভাই দেখো চক্ষু মিলিয়া শোন, এই দূরদর্শন, তোর কাউকে পছন্দ হয়েছে, তো দূরদর্শন করেই যাচ্ছিস, that won't work. কাছে হাত ধরে দেখো, নেড়ে চেড়ে দেখো, ফিল করো। ডাক্তারিটা হচ্ছে is a question of seeing and feeling. Now, হলো দেখে নাও, তারপর আবার 15 মিনিট দেখবে। Symphysis menti, the protuberance of the mandible. The mandibular foramen. Submandibular fossa. Okay. Now, Now see, this is the lateral pterygoid, and there is a muscle also medial pterygoid. Now the mandible is cut open. This is the head of the condyle of the mandible. This is the head. This is the articular disc. TMJ. It is famously known as TMJ. Temporomandibular joint. Now the articular disc, the head articulates with the temporomandibular joint. This is the temporal bone. This is the auricular. This is the, yeah. This part. No, here it is. Here it ache to na. Now the temporomandibular joint. You see, this is the, here. This is mandible condyle. This is the, now you can see, okay. Of course, this cannot do lateral movement. You put your hand in the in the temporomandibular joint, in this part. You see, you feel the, yeah. Okay. Now you can see, now how, what is the relation? Because the individual bone, you will be studying the temporal bone. Now the skull itself, now this part, yeah. This is the auricular, the orifice. এক এক করে দেখলাম, পাঠিয়ে দাও তোমার বন্ধুকে। Now, okay, one thing I tell you, you just, hey, ওটা এক মিনিট দাঁড়া, আমি পড়েই দিই, তারপর তোরা স্কালটা নিজেদের মধ্যে আলোচনা করবো, ম্যান্ডিবেলটা তোরা আলোচনা করবো। Now this is the head of the condyle, head of the, this known as the head of the mandible, temporomandibular joint, TMJ, right lateral Now this is the articular capsule, articular disc, lateral pterygoid muscles. Yeah. Now temporomandibular joint. Describe the temporomandibular joint under the following headings. Type, what type of joint? Articular surfaces, ligaments, articular disc, relations, movements, muscle producing movements, and applied aspects. This is a very important, the question might come. Okay. And the best illustration, I don't know about the future, the current textbook. If you want to, you are interested, please see Gray. একটা just phone নেবে বা তোমাদের tab আছে, you see temporomandibular joint, Gray's anatomy. The London edition, not American edition. Gray's anatomy, 35th, 36th edition, 34th edition, old edition it can be, but current will be given in your Google's internet. You please see it today. And also the movements are there. Okay, now the temporomandibular joint is an articulation of the mandible with the base of the skull. Here is the base of the skull. This is the base of the skull. Okay, and it is now type of joint. Complex joint, as it is, it has an intra-articular disc. Intra-articular disc. See, a person was going to abuse and say, Shala! Lockjaw. Yeah, this happens. So don't, hey, jhagda korbi na. So don't do fight, korbi na. You'll get a lockjaw. You have to go to the hospital and get it reduced. But why I'm telling you this anatomy is part. Actually, I think nowadays people yelling, but there is some subluxation of weakness in the joint. So some people are always prone to this lockjaw. Now, what is actually that the cartilage is there and the thing glides. See, you do like this. You are shouting, suddenly it glides because of your articular disc. Then what happens? It glides and gets locked. And it's a small space, It's a small space. So it just slips and comes like this. So it is a weak joint to some extent. It is like the hip joint. It is a stable joint because of its anatomy. Now what usually tie a gauze piece, make the patient sit in the table. Actually, this is the job of the dentist now. Nowadays, it is the job of the dentist. But from Shuri, Dubrajpur থেকে বেরিয়ে ওর একবারে Jharkhand border, Rajnagar, there was no dentist. You are the MBBS sitting. Now you try, then give an analgesic and all, and slowly you put your ha korte bolbe ha hoye ache তারপরে আঙুলটা দেবে you have to just press down and pull in front. You just press down and pull anteriorly. Then it gets stuck. It gets into its place. এবার এই শালা বলো তো শা ও আর ভয় বলবে না. Okay, now this is one thing I told you. এগুলো আগে করেছি, এখন লোক জানে যে দাঁতের ব্যাপার, হ্যাঁ, তো ডেন্টিস্টের কাছে চলে যায় কমিউনিকেশন, বাট অ্যাট টাইমস পিপল কাম, তো ও গজ পিস নিয়ে একটা অ্যানালিসিস দিয়ে একটা বসিয়ে বা শুয়ে অপারেশন টেবিল আছে সেখানে দিয়ে দিলে, এবার তুমি টেবিলে বসেও তুই বাট বি মাইন্ড ইট কামড়ে না দেয়, হ্যাঁ, তো ইউ হ্যাভ টু বি now see, it's a complex joint. It has an intra-articular disc. Bicondylar joint has the two condyles or heads of the mandible articulate with the base of the skull. Synovial joint has its joint cavity that contains synovial fluid. Thus, the temporal mandibular joint is a complex bicondylar synovial joint. That can be a short question. Ebar Subramay, your the answer script questions. Page 3, I think 3, your clinical oriented. Naturally, it can be a 10 marks question. Describe the temporomandibular joint. Just don't panic. You draw the diagram like this, and it is articulating with the base of the skull with a portion of the temporal bone. Clear? Mandible, I think most of you should remember the key things, key muscles, and আর এটা কি বললো মাইমটা বুঝলে, মাইমটা দেখলে the muscles of facial expression. It is Mukha Vinay. That is a famous mime artist. Huh? No, Calcutta's. Jogesh Dotto. Jogesh Dotto. So now even we are giving signals when you're not talking, or you had a fight, now you want to again reunite, then you do all different types of muscle expressions and things. Okay? Now, next. Now, see, you have it in your books, but I tell you, it's an important topic which is related with the temporal bone and the mandible. And the questions will come in case of mandible bone. What a temporal bone, the surface সেখানে won't be questioned much. So because of this, your mandible, it is the temporomandibular joint. Now, type complex bicondylar synovial. Articular surface, superior temporal bone, articular fossa, articular eminence, inferiorly head of the mandible. When you are seeing, then you take when you come to the class on your revision, or when you are dissecting the head and neck, then you ask for this specimen, or you have your book, or if you don't get it this articulated, you take a skull and take a mandible, and you have your book and read. In 3 months you have to slog it out. Okay. Now, the joint cavity, two compartments, upper menisco-temporal, lower menisco-mandibular. Now, meniscus is there. Meniscus of the knee joint. Similarly, having a meniscus, you are having your compartments are and your joint cavity has two cavities, two compartments, upper menisco-temporal and lower menisco-mandibular. Now, upper is menisco-temporal because the temporal bone is giving the contributing to the joints. Okay, and the lower menisco-mandibular, the condylar head. Okay, now articular disc, oval, fibrocartilage, superior convex, inferior concavo-convex surfaces, degenerated tendon of lateral pterygoid. Next. Now, when you read the temporal bone, you will be taught. See, this is the squamous part of the temporal bone. This is the articular eminence, this is the articular fossa, and squamotympanic fissure is here. This is styloid process and spine of the sphenoid. The styloid process is here. Styloid process is here. When you see this part, styloid process, that it comes from the base. Now, that has very important, there are numerous muscles in that small bone. Styloglossus, stylohyoid, okay. And this is tubercle, this sternocleidomastoid is this.